Happy October, guys! October! Okay, so what we're going to talk about today is something called UTI, and what that stands for is Urinary Tract Infection. The other medical term for this is actually something called cystitis. So you can call it UTI, urinary tract infection, or cystitis. What this is basically when you have infection of your bladder. So let's draw a lovely lady here. She's not the happiest lady right now because she has a UTI. So excuse my drawing here for a second. I'm just gonna do my best. But you have her hip area and her legs. Okay, so her bladder sits, let's say, in this area right over here. And when you have bacteria in your bladder, you get what's called a UTI. They say some of the risk factors of getting a UTI, or women who have UTIs, are a woman who's sexually active, so sexual intercourse, or a woman who has a history of UTIs in the past, or recent spermicide use. So spermicide is usually found in condoms or condom packages. So these are some of the risk factors of UTIs. UTI occurs again when bacteria enters your vaginal or introitus, and the vaginal introitus is basically the opening or the entrance of your vaginal area. And a lot of times you have bacteria that usually may come from your stool, and it may colonize in the introitus or the entrance of the vaginal area, and the bacteria then goes up your urethra, which is the passageway that leads to the vaginal introitus, from the vaginal introitus to the bladder, and it can colonize in your bladder. And so you have what's called a UTI because of the colonization of bacteria from the introitus to the bladder. They say that one of the most common bacteria that's the cause of UTI is actually something called E. coli. And I'm sure that you guys have heard of this before. It's actually the bacteria in fecal flora, or in what's found in your stool. They say actually 75 to 95% of cases of UTIs are caused by this bacteria here. There are other common bacteria, but this is by far one of the most common ones found. Let's talk about briefly what are the clinical manifestations or the signs and symptoms of someone who has a UTI. So, signs and symptoms. So some of the more common, and in fact the most common one, is actually dysuria. What dysuria means is when you have burning with urination. Another common symptom or sign is actually urinary frequency. So women who have UTIs tend to say they have to go to the bathroom more frequently because they feel like they need to urinate more frequently. Another one is actually urinary urgency. They have the intense urge to go to the restroom and urinate. So another one is actually something called hematuria. This one is actually when you have, or means blood in your urine. So if you have hematuria or blood in your urine along with some of these other symptoms, then you may very likely have a UTI. And last but not least, you can have what's called suprapubic pain, and this suprapubic area is the area right above your bladder, and you can have some pain or cramping in this area. So those are some of the common signs and symptoms of women with UTIs. In the very young and the very old, the signs and symptoms can be very subtle. So they may not necessarily have burning with urination or urinary urgency or frequency. So it may be very subtle, but if they have even the slightest bit of any of these symptoms or signs, they should get tested for whether or not they have a true UTI. One of the complications that I'm briefly going to mention right now is something called pyelonephritis. And this is basically a complication of a UTI. This pyelonephritis forms when the bacteria that entered your introitus and now colonized the bladder is now ascending up towards your kidneys. So there's these tubes here, and they're called ureters, okay? I'm sorry if you guys can't see that from my pumpkin here, but these ureters are actually the tubes that lead that go from your bladder to your kidneys. We all have two kidneys, and when you have this bacteria ascending up the ureter and then entering your kidney and then colonizing in your kidney, this becomes an infection in your kidney. And again, these are from the uropathogens that led from your introitus to your bladder towards your kidneys. Now, this infection here is called pyelonephritis. So again, pyelonephritis is actually a complication of a UTI, and this in itself has its own symptoms, which are usually a little bit more serious. They can have fever, they can have nausea and vomiting. They can have flank pain, which is flank pain is basically when you have pain on the waistline area, more towards your back. They can have something called CVA tenderness, costovertebral ankle tenderness. So if you tap on the back of this lady here in the region of the level of the kidneys, where the kidneys would sit on the back, they'll have pain when you tap on it. And another thing is that they can have headaches. Okay. It's not necessary that when you have a pyelonephritis, you have all the symptoms or signs of UTI. You may just have these symptoms and have a UTI along with a pyelo. But again, this is a complication of UTI. We'll talk about pyelo maybe in another video one day, but right now we'll just focus on UTI. Okay. So let's go on to diagnosing. How do you diagnose a UTI? So the way you diagnose a UTI is by getting what's called a urinalysis. And let's go over that real quickly here. So a urinalysis is usually tested under what's called microscopy in a lab, or by a dipstick. So they test to see if you have what's called leukocyte esterase, and if you have what's called nitrites. And these are just enzymes that are broken down by bacteria, okay? In urine, in normal urine, you have what's called urinary nitrate. And when you have bacteria in your urine, that urinary nitrate gets converted into nitrites. So usually in a urinalysis, when you're testing to see if you have a UTI, you may have findings of leukocyte esterase or nitrites, or you may even have what's called we mentioned earlier, is blood, right? Blood in your urine. You would go to your doctor's office or urgent care emergency room, wherever you may go, and they would just quickly do a urinalysis, and they may be able to find these results in your urine. If you do test positive for any of these, again, it's pretty much confirming that you have a urine infection. Okay, so next step is, I did want to mention that when you do collect your urine, they're going to ask you to collect it and to give your urine sample in a little cup. You want to make sure that when you collect your urine in the cup, make sure that it's what's called a clean catch. So they're going to give you a little wipey, and I want you to, or you should use a wipey to kind of wipe that vaginal area before you put the urine sample into the cup. And then also you want to catch the urine sample midstream. So not when you first initially urinate, but midstream clean catch should be the best ideal sample for your urinalysis, just so that you avoid contamination of your urine sample. Okay, so next we're going to talk about some of the common antibiotics used to treat UTIs, okay? So there are actually several antibiotics used. Let's go over one. So antibiotics, so one of the more common antibiotics is what's called macrobid, and this is also known as nitrofurantoin. So this is very common antibiotic used to treat UTIs. Another one is something called Bactrim, although this does have what's called sulfa, and some people can be allergic to this, so just warning there. Also, another medicine is called ciprofloxacin, and this is actually the go-to known as the only oral antibiotic able to treat outpatient therapy for pyelonephritis that we mentioned earlier. And then another antibiotic that's commonly used is something called Keflex. So see, these are some of the common antibiotics used to treat UTIs. Depending on any history of allergies to antibiotics, or tolerances to some of these antibiotics, you definitely want to let your doctor know or provider know which one worked for you maybe in the past if you've had UTIs in the past, or you may want to let them know what allergies you may have. Remember, there's something called antibiotic resistance, and antibiotic resistance is when your body is not responding to a certain antibiotic. Some people may have resistance to Bactrim, and when they're taking Bactrim while they have a UTI, their symptoms may not go away. Usually, your symptoms should improve in 48 hours, okay? So the number is 48 hours after starting antibiotic therapy. So if you're not having improvement after about 48 hours of using antibiotic, I would suggest that you follow up again with your doctor just to maybe get what's called a urine culture. Urine culture is great for testing to see if you have what's called antimicrobial resistance, or if you have, or they need some kind of susceptibility data. Some people, again, can have antibiotic resistance, and in that case, urine culture would be beneficial because it'll let you know which antibiotics you're resistant to and which you may be sensitive to. Okay, so that pretty much concludes this section of UTIs. Another bonus medication that I did want to mention is a urinary analgesic. Basically, when you have a UTI, there's a medicine that can help with relief of the burning with urination, the discomfort that you have with the UTI, and this is known as Peridium. Another one called Azo. This is over the counter. Another one's called phenazopyridine. And these are, again, what's called urinary analgesics. It'll definitely help relieve some discomfort and the burning with urination you may have. Okay, so before I conclude this video is not meant to be a substitute for any kind of medical recommendation, or it's not meant to be, any kind of substitute for a medical professional provider. This again is just to give you just some information, brief information on what UTIs are and the general signs and symptoms, and the common antibiotics, and the definition of basically what a UTI is. So that pretty much concludes this. Thank you so much for watching, and hopefully we'll see you in the next video with a new topic. Let me know in the comments if you guys have anything you'd like to know more about in terms of some diagnoses or medical conditions, and I would love to make a quick short video on it just to keep you guys informed. All right, thanks guys for watching, and have a good day. Bye.